to the Impact on the Ground with Tiia. I'm the CEO of a Tech for Good company and passionate about making a difference. This podcast series will dig deeper into what it means to make an impactful change in society, whether you are an individual, charity, social enterprise, company, or grant maker. It is all about collaboration and finding right partners, and we are here to talk what this means in practice. We focus in our conversations on the dynamics between those who have resources to give and those who are working to tackle the challenges in our society on the ground. Today, I have here two guests. I have Joe Oxlade from Brook charity and Marian Nicholson from Herpes Viruses Association. So welcome both.
Thank you.
And what I would kind of like to say as an introductory, words here, I guess today's theme is to kind of have a discussion around how could companies, corporates, support charities in a little bit more wider range. 1.5% of charities get 70% of the sector income. And we see quite often that very kind of large, quite obvious causes and charities get the corporate support. And we would like to discuss how we could kind of think things in a new way, since company and corporates support is increasingly important to the charity sector when grant makers are not increasing their budgets, and also governments have difficulty in raising theirs. So many causes now start to rely on company and corporate support in terms of grants, other money donations, skills-based volunteering, product and service donations. And we would like to now discuss how these kind of new causes and a little bit different kind of causes, and maybe causes who have a stigma around them, could be finding their way to corporate support, and why should corporates consider these kind of causes to fund or support with. Anyway, so Joe, why don't you start with explaining what does Brook do? Your mission is to equip young people for life's challenges, and this is very much aligned with very many company and corporate mission as well. But what do you do exactly, and what has created difficulties in your causes to maybe collaborate with company partners?
Thank you. Brook is is the UK's leading sexual health charity for young people. So we deliver a range of sexual health services and wellbeing support to young people across the country. We're now 50-something years old, and we developed into a young people's charity. We deliver statutory services, so we are commissioned by local authorities to deliver health services in various parts of the country. But more and more, we are doing more around education and wellbeing support for young people as well, particularly around healthy relationships, particularly around issues around online, issues that young people face online grooming. We do lots of work with talking to young people about consent and what is consent and what isn't, and how that transpires into healthy relationships. Lots of work in schools around early intervention and prevention, so talking to young people about their sexual health and their well-being before it becomes an issue, and like I say, delivering clinical services alongside that as well in various parts of the country.
So you work with certain companies and you have partnerships.
We do have partnerships. I mean, sorry, our main source of funding really is through our commissioned work. So we are commissioned, it's through local authorities and it's public health funding, and local authorities have a statutory, are required to provide sexual health services. In the past, those services were, there was funding ring fenced for young people's, for targeted young people's services ran independently from adult services. That is now not the case. So so they're integrating those services. But we do work a lot in partnership outside of those local authorities. So we do have some corporate partners, only a small number. We work lots in partnership with lots of schools, with lots of other charitable organisations. We do work with substance misuse organisations, with lots of other young people's charities, lots of campaigning and advocacy work as well, talking about young people's rights.
Yeah. Okay. Well, interesting, and we'll get back to this company support bit. But
yes.
If you, Marian, tell about Herpes Viruses Association and what do you do? Of course, the name tells quite a bit, but please tell a little bit about the history and the services you provide.
Thank you, Tiia. The Herpes Viruses Association, I thought, was quite a long-standing sexual health charity because we were set up in 1985. But hearing about Brook makes me realize that some organizations are going a lot longer. The story of herpes is a very tricky, double-edged one. You see, before about 1980, having a cold sore anywhere on your body was not regarded as any sort of problem. In fact, genital herpes, or cold sores on the genitals, weren't even recorded as an STI, sexually transmitted infection, at that time. And then along came the cyclovir, and suddenly people were treating herpes simplex in clinics, and so they started recording the details of it. And of course, because they hadn't been recording before, and now they suddenly were more and more, they sort of discovered that the statistics were shooting up the graph. Now, when each year the government produces the list of STIs, the report, it comes out in July each year about STIs, the fact that herpes was shooting up the scale was a great story for the press. And it started to be hugely reported and indeed stigmatized, because after all, you catch it doing sex. And of course, no nice people ever do sex in Britain. It became stigmatized, and it was interesting in those early days. People who'd had it for ages would say things to us like, I've had it for ages and it wasn't a problem to me, but now suddenly I realize that it's something really important and serious and terrible, and I should have been worried all this time. And we would go, no, it's just advertising, you don't have to do it. But once the press, once the society has got hold of a stigma, it is incredibly difficult to let it go. Anyway, what do we do now? Well, we supply advice and information to individuals who are diagnosed and who find us and need support to improve their expectation of future life. The way that medics talk about genital herpes doesn't help, because they use medical words that to the public mean something else. So for instance, a medic might say that it's a chronic condition. That to a medic means that it is a long-term condition. Doesn't mean that it's serious. However, on the street, if you use the word chronic, it's good or awful, something terrible. We also, of course, try to publicize good information. We've had a few successes, but then again, it's very difficult where something is so stigmatized. A, to find somebody who's prepared to go public, and B, to get it accurately reported in the press. So for instance, the Evening Standard did a wonderful article. One of our ladies gave her personal story all about how she'd been concerned at first, but now she was totally sorted. She was married with 2 children. However, when it came to writing the headline, I'm afraid that the headline writer saw the word herpes in the first paragraph and wrote the headline, "How Herpes Ruined My Life." This was not the story at all. The story was, I'm living perfectly happily with herpes. Now, when it comes to funding, of course, medically, and if you ask the Department of Health, they will say herpes is a totally unimportant virus. It doesn't have to be treated. A few people get it badly. Most people who catch it do not know they have it. Only 1 person in 3 who catches it gets it badly enough to be diagnosed. So they're going to say, no, we don't need to spend any money on herpes. Good gracious, no. It's not like chlamydia that makes it difficult to conceive, or syphilis that kills you and that kind of stuff. And then when it comes to corporates, well, it's sleazy, isn't it? Because only people who have sex catch herpes. And as we've said before, no nice people in Britain ever have sex. And when it comes to asking for local volunteers or for corporate departments to sponsor something, no one wants to be the person who speaks up at that meeting to say, why not the Herpes Viruses Association? Because, of course, then everyone will know that person must have herpes. I could go on for a very long time, but Tiia, that's probably given you an idea.
Okay. Yeah, so I read the WHO statistics and also from your website, 70% of the population all across the globe has herpes virus. So it's very common, and whether it's type 1 or 2, and nowadays they are also mixed. So whatever used to be the cold sore on your lip might be also in your genitals and so on. So the viruses have kind of mixed and so on. So kind of it's not even sexual transmitted disease if you don't consider kissing sexual activity. So and so on. But yes, I totally get the point. There are in the past, like obviously it's not this kind of like a sexually transmitted disease, but like prostate cancer didn't used to be kind of a cause that would be funded by corporates, but then there was a quite big rebranding, and all these Movember campaigns who are really raising money for the prostate cancer awareness and kind of saving lives and stuff. Do you think this kind of a rebranding work could kind of help? And Joe, I think you are, in your branding, you're talking about a lot about self-confidence and kind of well-being and health. Is that intentional? Is that like a branding thing that you wouldn't talk about sex in that?
No, we will always talk about sex because that's our core work. And a bit like Marian said, I think sort of several years ago, or even maybe 10, 20 years ago, the thought was, if you don't talk to young people about sex, they won't have it. Well, hey ho, yeah. They're all here because somebody's had, our parents have had sex. Now, whether they, who knows when they started, but young people have always had sex from the moment that humans started walking the earth. So not talking about it does not mean it's not going to happen. And actually the evidence states that if you don't talk to them, more young people will more likely display risky behavior or have risky sex than if you talk to them about what good sex and healthy sex is. So we haven't purposely rebranded to not talk about sex, but we have we had a rebrand, and we've never changed our name. We've always been Brook, but we did rebrand about 4 years ago. But more really to talk about actually what is the impact of our work, and the impact of young people having healthy relationships and knowing what healthy sex is, and that sex can be pleasurable. We talk a lot about pleasure because that is that is the way of getting young people interested in talking about this subject, actually, rather than the biology of it all. You start talking about how pleasurable it is and how wonderful it can be. That's the hook to get young people engaged. But obviously, like all of these things, if you have poor relationships, your well-being, the chances are you've got poor well-being, or maybe poorer mental health issue, or mental health issues or problems. And if you've So it's all very interlinked, and I think it's hard to, I don't think you can separate the two. Having good, healthy relationships will lead to improved self-esteem, self-confidence, which will, you know, it's self-perpetuating. And I'm sure it's the same with Marian and the Herpes Virus Association. You know, that if people understand that it's not something to be ashamed of or stigmatized, the more confident they will be and the better life outcomes they will have.
Definitely.
I agree with you.
Yeah. So could you say just maybe some outcome, Joe, about your work? I mean, in your website, you say that you reach 1.4 million young people annually. And if you think like corporate partnerships, that's a quite big outreach.
Yeah.
It's just so as a contact and kind of brands to kind of communicate that, hey, we are supporting this organization and the work they do, you know, so it's a good outreach. But what is your kind of certain outcomes and statistics?
Well, I think you know, our outcomes can be, we do a lot of work. So all of when we're delivering our clinical services, which are very, like I say, it's public health money, so funding. So we're always working towards the public health outcomes, and there is a public health outcomes framework, and there are a number of outcomes that are associated with good sexual health, and those outcomes are things like uptake of long LARC contraception, which is long acting reversible contraception, so things such as implants and coils, that type of thing. So uptake of contraception, which, you know, in turn will reduce teenage pregnancies, or reducing the STI rates, HIV prevention, those type of things. So there are the harder outcomes, which are very much around those. But then there is all of the well-being stuff, so very much around increased confidence, increased self-esteem. The other area that we are now really focusing on is about empowering young people to take control of their own health care. So quite often when they come to Brook for their sexual health services, that will be for a young person the first time they are going to a clinic or a clinician or a healthcare professional to talk about their healthcare, their own healthcare, without maybe their parents being involved. So ours is very much now around promoting self-care, which there's very clear evidence that, you know, the more we can encourage self-care from an early age, that has outcomes throughout a person's whole life. Taking charge of their own you know, their own health.
What about Marian, your impact? Because that, of course, we should be only talking about the impact. It's not just the cause, but, you know, kind of the change the work generates to our society. What is it with your Herpes Viruses Association?
Our services are anonymous because of the condition and the stigma. This means that we can't actually collect individual data. However, for the numbers, we get 500,000 almost visitors to our website every year, and we get 2,000-3,000 phone calls and another 1,000 email exchanges. I say exchanges because, of course, one of those email exchanges might be 10 emails, you know, one after the other, as the person slowly divulges more about their condition and their worries. So it's almost counselling by telephone, counselling by email. The statistics that I've given before and that you mentioned, Tiia, about how incredibly common this virus actually is, can be helpful. But I agree with something that Joe said there, that I think the self-confidence or the personality of the person makes a huge difference when they catch the STI. Over and over, callers will say, I've only had 3 partners, or I'm 58 and I shouldn't be catching something at my age. People have a totally unrealistic attitude towards sexual health. It doesn't matter how often we tell people you can get pregnant from your first experience, people still associate unfortunate outcomes with too many partners. And this is just so utterly ridiculous.
Yes.
So anyone who understands about these things knows that. We get a lot of wonderful unsolicited testimonials. People who say, I wish I had found your website 6 months ago. I've spent 6 months in hell. Your website has totally changed my attitude towards it.
Yeah.
We're now running, thanks to Zoom, monthly meetings for anybody to come to. And on one occasion, I had to actually close the list at 35 people because you can't really have an effective Zoom session with so many people. Of course, a lot of those people don't turn up. And equally, when they do turn up, an awful number of people, I mean, nearly half on our last call, chose to turn up with a black screen and not to say anything. That is the level of stigma. Even amongst a group of peers, they refuse to show their faces or say anything. They just want to hear and see other people, normal people, who actually have genital herpes. It is astounding.
Yeah. Interesting you say that, Marian, because some of the feedback that we've had from young people over the last year throughout the pandemic. So obviously, everyone's lives has changed beyond imagination in the last year, and we've kept our clinical services open throughout the pandemic. And we had to adapt our clinical services, so we couldn't continue to do walk-in services. So our services that usually would be just for young people to drop in, and they would have to wait to be seen. But we had to move to a sort of a triage telephone system, an appointment system. But one of the feedbacks that we got was because young people were at home, making those phone calls where they could be overheard by parents or siblings or carers or other family members created. So again, it's that so for young people, it's the worry that they're being overheard by people, and you know, that could be for family reasons, cultural reasons, or just their own embarrassment, or them not wanting to share that information. But it all impacts on people's health and well-being, of course.
Yeah. One thing I wanted to just say here for our listeners, that we're going to start talking about the companies and corporates' roles in the support, that in the UK, companies and grant makers contribute pretty much like 10 to 12 billion annually to the pot of charities. Approximately half of that is from like traditional grant makers, who might be, some of them founded by a company as well as their foundation or something. But then there are billions of annually given by companies. And it's not only like a biggest companies who give grants. Yes, we might be reading that some big company gave 1 million or 2 million or whatnot, but you know, hundreds of thousands of SMEs in the country, you know, they fundraise, they staff fundraise, they have smaller grants, they give money, so they play very, very big role. And every single company who is small or medium-sized should also consider whether they could be doing something in terms of funding, but also then giving skills, which is much more impactful than just like normal volunteering. And also, even nowadays, with Corona time, you can still volunteer with skills rather than going somewhere to paint the fence. And also product and service donations are very much appreciated. They save so much money from charities if you don't have to purchase something worth of tens of thousands. And obviously the cost for the company who is contributing wouldn't be tens of thousands, because it's only their, you know, their own cost that actually is the cost factor to them. There are also very positive tax implications to companies for various donations, and government website gives very clear idea on that. We have also a blog post about this, that, you know, you can start inspecting that what kind of relief, tax relief you get from corporate tax. So it is actually quite beneficial for companies to give something. But like we were talking that, you know, when I said in the beginning, I'm now sharing my screen, there is very simple image here that we're talking about nowadays kind of CSR and corporate social responsibility, or company social responsibility should be done with strategic approach. And obviously that's a smart thing to do, kind of think about how the business can benefit from the collaboration and what would be kind of the impact that the company wishes to make through the donations. And the very common way of doing this is kind of think about that, okay, if we are like a finance company, maybe we want to support young people to study finance, for example. So that's kind of quite obvious. Then there are a lot of talk about the locality, and most of the companies, even they are big nationwide, or maybe they are not kind of located anywhere really, but if they have any kind of presence, either employees living somewhere or branches or offices, they want to contribute in local manner and kind of make their statement in local aspects. And there many times companies actually let the employees choose whatever they want to support, which again makes kind of sense, you know, that employees can then use their volunteering days with the charity who, you know, who they choose, and what cause is important for them. And of course, there might be some guidance as well. I assume that, you know, it's very hard to find charities to support in local level. And this is based on our research, but also others, like a secondary research we've been reading throughout the years, that it's not that simple that people would have lots of local charities on top of their mind and just thinking, oh, who I should volunteer with this week or next week. It's actually quite tricky to do. So companies could maybe create some kind of a system around this as well, that makes it easier for employees to then find a local opportunities, and maybe give some guidelines about the impact as well. What kind of operators create what type of impact, so people could choose wisely where they spend their time. Then we come to this societal environmental dilemma corner here, which I think would very much apply to you. Of course, there is industry alignment, especially Joe, you work with some like medical companies, don't you?
Yeah, we do. We've done some partnership. In fact, those are our most successful corporate partners, have been those sort of pharmaceutical companies, which obviously there are some very strict guidelines around pharmaceuticals supporting charities, particularly charities that may be using their drugs. But we've done some quite successful work, and our most recent, and probably we've had two really recent successful partnerships. One is with Caniston, who provide sort of over-the-counter medication for various health conditions, but sort of thrush. And so we've done a big project with them around intimate health, and getting or sort of encouraging young people to think more about their vulvas and their intimate health. And we've also done a really great project with Lillet, who are a period product company, around in an education program around periods and puberty for particularly based towards young women and young people who menstruate. So we've had two successful.
So that's kind of an example of the industry kind of knowledge alignment. Yes. But then, you know, if you think about all these thousands of other companies who work in fashion or whatever, just other kind of, you know, areas, banking or something, you know, I guess, you know, this societal and environmental dilemma, you know, kind of thinking about as a company or corporate, that what is this kind of dilemma that touches lots of our clients, for instance. Like in your case, everybody has is either young people or they have parents and so on, and so it's kind of like everybody, I would say.
Yeah.
Yeah, and you know, maybe just taking also this kind of a course that then, you know, is societal, or maybe it's an environmental, that you just choose kind of because it has a very vast impact. You know, it's something that maybe not so many support at the moment, because then you get a lot of like brand awareness for that as well, and stuff. What do you say, Marian, about this kind of a approach? Do you think that any company or corporate could be encouraged to support your organization in this societal and environmental dilemma sector?
Well, in the days when there was a patented medication for genital herpes, we got a couple of very nice grants from the pharmaceutical company that made that particular medication. I don't think that would be allowed today anyway. But now the medication is all off patent, so there's no chance there. As far as brand awareness, I think that it would be a fabulous joining if a really edgy brand that wanted to display how incredibly up to the moment and risk-taking or exciting they were to do something with us. But it's a risk, because even young people who are enthusiastically having hookups, or they were before lockdown.
I think they still are, Marian.
Judging by the statistics, it seems they are, yes. But anyway, you can see what I mean. Even they will say only nasty, promiscuous people get herpes. I don't want to have anything to do with a company that's associated with nasty, promiscuous people. I only sleep with one guy each weekend. You know, a new guy each weekend, but it's only one a week, so I'm not a nasty, you know. People will always choose to stigmatize people who they perceive to be doing something that they would not, or they feel is outside the pale. And so it's tricky, but it would be a delightful experience to join up with some really brave brand. I'm not sure which brand would wish to do it, but
well, I think, you know, like you said, that there is, when there is a little bit of a risk or this kind of like a stigma around it, and yet, you know, times have changed as well. So, you know, I think there is a great opportunity, but I guess if there were this kind of a campaign, maybe also some kind of brand strategy agency could be giving you support as a pro bono, and kind of trying to figure out these kind of collaboration models and the messaging and kind of the story around the collaboration that would make it exciting and kind of positively edgy, I would say. And
I love that. Thank you, Tiia. That's a brilliant idea.
So maybe this is a now nationwide call out, you know, funders and you know, brand strategy agencies and marketing agencies. You know, your help is required, I would say, and you know, some kind of a like innovative collaboration model. And then I guess it's about then just picking up the phone and creating materials and starting to offer this kind of opportunity. It is a fact, research fact, that 91% of the companies do CSR activities because of brand building and employee engagement. So it's kind of like we shouldn't just think that, you know, kind of as a corporate level, as a strategic choice, it's just out of a goodwill. There is always requirement for some kind of like a counter services or something to be gained. And I think your both organizations present a great opportunity for many companies. You reach so many people, like your Marian said, 500,000 website visitors, you know, quite, you know, stigmatized subject that you would get publicity if you play the game right, but you could get like really cool publicity. Joe, 1.4 million, you know, huge reach. And this is exactly what many companies need. Not just like maybe market some clothes or something, but also, you know, there are opportunities to conduct surveys, you know, anonymous surveys, collect some data kind of with your help, and kind of also get your, you know, kind of expertise to advise them on something that the companies could use in their own kind of kind of a service and product innovation, you know. And I think the story kind of supporting something that touches everybody's life, you know, and in your both cases, you know, that's kind of the case. And there are so many other also charities and causes that are exactly the same, but struggle to get their, you know, message around to companies and find those bravest companies and most innovative companies to support them. But
I think I agree with Tiia. I think with for both Brook and Herpes Virus Association, I think once you start to unpick what we do and the impact of the work we have, people really get on board with it. But it's trying to get people to unpick it. I think that's the hurdle for us. It's once you've got someone on board, it's not a problem convincing them of what we do and the benefits of the work and our reach and everything else. But it's getting people to buy into it in the first place and to understand the impact of the work that we all do and our reach. Because I think you're right, our reach, both ours and HVA's is incredible.
Yeah, definitely. I mean, companies pay hundreds of thousands of pounds annually to treat this many people.
Yeah.
Message it. So, you know, maybe there could be some potential collaboration. But Marian, if you now had a wish list, a couple of things that you would really need from companies or corporates, what would it be? Of course, everybody needs money, yeah? So, but what else would you need?
You talked about skills they might have. Because we have only one small office in London, and because our helpliners all have to have one essential ingredient, which is a personal experience of genital herpes, that sort of puts that out of the way. But when it comes to our website, obviously, the sooner people find our website, the better. Therefore, help with improving our website, whether it's SEO improvement or whether it's design improvement, that would be really interesting and helpful for us.
Okay, Joe, what would you need? You're
a
partner organization. How many people you have working for you?
So we have about in total our head count is around about 250. We are quite a large organisation, and I think that the trap that we fall in, or the trap that we can fall into, is the fact that we do receive funding from local authorities to deliver our services, but of course that funding pays for that service to be delivered. It doesn't provide us with a slush fund to then go out and do the sort of more innovative, exciting stuff. So yes, we're always looking for funding. I think from a skills perspective, we've got trustee vacancies at the moment. Yeah. We do struggle to fill those. And interestingly, we are looking for a trustee at the moment with corporates, sort of experience of engaging corporates. That is our sort of, we recognise that as a big gap, as we don't have the resources to service those relationships as well, because they you know, we recognise that they do take resources. You can't just develop a partnership and let it run its course. It needs resources to manage and support.
So maybe then a trustee with some experience, but also maybe extra hands to this person. So if you find a trustee from a company, there might be other people like team members of the person, like as advisors. I assume that, you know, it is quite time consuming, that it requires like a monthly input, some days and stuff. So that might be even a team effort, of which one of them is then the trustee, you know, and then other people helping out. But
yeah, absolutely. And then I think from the traditional sort of volunteer opportunities are more tricky for Brook, because our services, like Marian's, are confidential, so we can't have volunteers going into our clinics and supporting our clinical work, because they're confidential services. And you know, I wouldn't be able to go into one of our clinics because I don't have the training and all the qualifications to do that. You know, we're working, we've got a consultancy doing some pro bono support with us at the moment about developing some marketing, some strategic work around our marketing and how we can engage more schools within to support our education and professionals training activities. So it's quite hard to pinpoint where we need support, because usually if somebody would come to us and say, well, this is my expertise, can you use me? We can probably quite often do that, but it's not always necessarily an obvious gap. But the one obvious gap for us at the moment is absolutely trustees. We have trustee vacancies that we are looking to fill, so that would be amazing.
Yeah, we have found this in our own research, at what impact that there is a huge gap in this, like a collaboration, exactly that charities don't know what they could ask, because obviously you don't know and you cannot imagine what some individual people would be ready to give or what the company would give in certain level. And then the companies don't realize what kind of resources they even have that you would appreciate.
Yeah.
And also, you know, like product and even service packages, like they are not that common offer. Skills-based volunteering, yeah, but then it's hard to find the matches. Obviously our platform now will help these transactions and find the partnerships. So please, you know, post your project and start applying. We have already quite a nice selection of companies offering specific stuff, and more to come. But there is a gap in the market, and I think it really, you know, requires, you know, a little bit inspection. But yeah, we are also here to help. But our time is running up, so I must say thank you for you both, and I hope that listeners, you know, work in some companies, you know, who might be interested in contacting you. You will be found hopefully on whatimpact.com, but there's also lots of other type of charities and social enterprises on whatimpact.com, also blog posts and videos and other podcasts. So if you want to kind of get insight on the collaboration and how you should go about it. And we have also intercom channels, so there is easy to just send an email or intercom message, and somebody will contact you and can speak with you over the phone, in person, whatever organization you represent. But where can people reach you, Marian? Are you on LinkedIn or as a person?
I'm on LinkedIn as a person.
Yep.
We have a Twitter account, Herpes UK, but the website, herpes.org.uk, and our contact us page there is the easiest thing to tell people about, herpes.org.uk.
And it was Marian Nicholson on LinkedIn, yeah?
Yes.
What about Joe? Where can people?
Same, I'm also on LinkedIn, and I think we have a number of social media, we communicate via a number of social media platforms, as you can imagine, when dealing with young people. But I think the easiest way is www.brook, which is BROOK.org.uk.
Yeah, okay. Well, thank you so much for this conversation, and see you soon. And
thank you, Tiia. Thank you, Marian.
Very interesting. Thank you, Tiia.
Thank you.
Lovely to meet you, Marian.
Bye, Joe.
Thank you.